Hi, everyone. Welcome back to the podcast. If you're a new listener, welcome. If you're coming back and listening to some of my content from the past and you've been following, welcome back. This is a fantastic topic I wanted to share, and this comes from a lot of people who have asked me what it's like to be in professional sports. What does a week look like? Before I go on to the podcast, just a little housekeeping and things coming up down the pipeline. I always like to keep you guys updated on everything that's happening in my world, both personally and professionally. Let's see here. We in sports performance in Chula Vista, we are currently recruiting a new marketing assistant. So I'm really excited about that. We have interviews actually today for a physical therapist position, and we actually just kickstarted a marketing assistant for my side, for the Dr. Chris Garcia side, and Kenshin. Excited to have this guy on the team. He'll be leaving for BT school soon, but all good things. Personally, I am going to take a week off in the near future to work on some personal development. I think a lot of you have told you that I'm working on a book at the moment, and I'm hoping to finish it up this month. So there you have it. There's all my updates personally, and on to the podcast. So does a what does a week look like in professional sports as a sports physical therapist? So, and there's going to be multiple contexts on mm, how people spend their time. It's a long week, I will say. Depending on in season, out of season, the type of sport, is it seasonal or is it all year long? And I'll give you my perspective from working in a couple different industries, some seasonal, some all year long. And what you have to put in context is that when you work in professional sports, this is not a normal work week, and your standards are now changed. Your work-life balance will change based on the position that you have. So let's start this off. You'll come in. I'm going to give the context of working in, say, Olympic sports. So you've got track and field. You've got you can winter or summer. Let's just go summer because I'm familiar with that. So in that context, we're just Monday is the start of a new work week. But however, these people have been training all week long, and so Monday is Monday to you, but it's Groundhog's Day to the athlete, and that is the truth. And they will be the first to acknowledge that when you are training all year long, the same Monday feels the same as Friday, and Wednesday feels the same as Saturday. The only difference is what intensity and what am I doing on that day. I can tell you from personal experience, it is very challenging mentally as an athlete to go through that, and it's the person who has a vision and a dream to do something bigger and better for themselves. That's the accomplishment they're trying to achieve, that feeling. And so Monday you come in, you realize that over the weekend they might have some bumps and bruises. Monday morning you have injury checks. What are we working on? What's the injury of the week? What's the flavor of the week? And you'll see Sunday for majority of people is either an active recovery or a complete rest day. So most people are recovering from Sunday. Coming on Monday, you've got injury checks Monday morning. Any fine tuning, you come in at 6, 7 a.m. Make sure they're good to go for practice. So we would have a field on the just located footsteps away from the medical facility. So you now have medical checks, injury checks, any pre-practice taping, and from there you're going to send them off to practice. You'll join them for practice, make sure everything's running smooth. Their mobility looks great. You're going to help out with general warm-ups. They're going to have technical coaches and strength coaches to help them facilitate most of it, and all you're doing is relaying in a good way that we framed it and that we created is a green, yellow, and red light system. So on the red light system, no go for that day or that week. And so you have kind of a big Google sheet or a spreadsheet of athletes and where their red lights are, yellow lights and green lights, so the coach can easily see what athlete can do what, And that helps them frame like, okay, so this person can't accelerate, they can't sprint past 75, this person can't do lateral movement, this person can't cut, this person can't do deceleration because they have patellar tendonitis. And so the coach can then say, okay, from a warm-up perspective, what am I changing? Who needs to do what? So when people have a lot of red lights or yellow lights, the coach can easily say, you know what, we're going to bring you, and excuse me, we're going to help you work with the strength coach or the assistant coach, because it's going to take a lot of time. And that's not a problem, but what it allows you to do is tailor people's daily practice according to what they need. So you're going to go watch, hang out at practice, make sure everything's running smooth, the tape that you applied is working, so that you can get some feedback from the athlete, thumbs up, thumbs down, tighter or less, what do you need? Watch them at practice. They're going to come back from practice, and then you're going to work on anything that you need soft tissue wise and recovery treatments, any corrective exercises that they might need that they've been working on for the week. Then everyone goes to lunch. We also had a cafeteria, dining hall in on site, so you're kind of traveling in packs. All you're doing is just going from one station to the next. From lunch, everyone then goes back to either take a nap, relax, cool down for a little bit, and then that's when you're doing all your back end planning. You're doing paperwork, you're doing notes, you're doing corrective exercise programs, you're doing strength protocols, you're working with coaches on what needs to happen for the week, set it up. And then after you do all that, in the afternoon, it's strength time. Then you're going to go to the weight room and work on just general strengthening with the athletes. Make sure that you're going to be working with the strength coach. You kind of generally assess and help them wherever they need, and then tell them the same thing: red, yellow, and green lights on certain things. So if they can do horizontal pressing, linear progressions, plyos, can you do lateral strength? Can they do eccentrics? What are they working on? So then from there, you're working, an hour or two watching the sessions, and then you have another session afterwards, and that's any recovery things that need to be done. Most of the time, these are, passive recovery techniques. So they're going to be either in ice baths, ice, heat. They might have a massage for the day, and then you're basically helping this athlete map out a week. More importantly, what changed the game for me was helping me understand I'm actually looking at a year. As a physical therapist, a trained physical therapist from a school perspective, you're just looking at 6 weeks, maybe 12, maybe 18, maybe 24 weeks max, only because that's the permission that you've been allowed to think like. And with all due respect, if you've heard my podcast on school and some upcoming content that I'll come up with as well, as my perspective on how that kind of sets our framework up for a little chaos down the line. But with professional sports, it really helped me allow a better understanding of what I do for a person versus what I'm allowed to do in 6 weeks, 2 times a week, or 12 weeks, or a post-op knee. It allowed me to see where I can actually support an athlete a little bit more and work with other team members to do the same. So across the week, we'd look at what do we need to do. We'd actually map out the whole year, generally what phases they're going to be working on from a strength perspective, and then from a coaching perspective, what tournaments are coming up when, and what that means that they're going to have highs and lows of peak times and then recovery weeks and whatever it is. So what that allowed me to do is help see when they're going to have higher stresses. So if I knew the work week for the year, I knew that strength wise they're working on strength endurance, power endurance, acceleration, plyos, cleans, snatches, whatever it is. I could see, man, as they go up in a certain time frame, I knew that there was going to be some injuries, which means that all I had to do was bring them into the clinic, make sure that their correctives were and their body, their tendons were ready to load. So then you have to kind of work backwards. Well, how many months is that going to take me to have them prep for that? So you would have an annual planning in the off season, postseason, and you can look at summarize how many injuries happen across the year, and then what's the new schedule look like, and then you would map out across the year. But to understand what a work week looks like, you kind of have to understand the bigger framework of what does a year look like. And I'm just going to shorten this episode down with just a week. So I said Monday, In the evening, you've got passive recovery techniques. You might have massage, you might acu, you might have chiro, you might have PT, whatever it is. So with all of that, all you're doing is what else do they need? It's very easy to get into the concept of, well, why don't they just have massage and therapy and all this stuff every day? It's a time consumer, and when you look at it, we always had to look at research and what is the most bang for our buck. And between nutrition and sleep, those were massive. So even if they had 10 hours of therapy, but they didn't sleep much, it actually took away from the recovery. We noticed that when people had high life stressors, both personally and in their sport, they were having a harder time actually performing. And even if we gave them all the therapy that they needed, if they weren't resting and eating well, it was very tough for them to perform at the highest level. So we actually staggered how many treatment schedules or how many treatment sessions were needed across a week. But if they were banged up here and there, we can apply tape, whatever it is. But behind the scenes, we built preventative strengthening programs so that they can maintain those. And then that allowed them to stay healthy as they continue to train. And then they can have weekly sessions based on whatever came up for that week. So then Monday night comes around, we work on them, make sure that they get out of that training room, get to the dining hall, get dinner, and everybody's in their rooms by 8. And I don't remember if there was curfew, but there was definitely no noise after a certain time point. I can't remember exactly the time, but ultimately it was like a campus. And what you do then is finish up. You're out of there by 7 p.m. Finish up notes, sending last emails to make sure that coaches know what's going to happen for the next day and they can forecast. And what you realize is everything that you do helps other people plan. And that's really difficult for a physical therapist mindset because we're not used to that. Typically, we had some amazing athletic trainers who just lived in this world, and I learned a lot. I learned a lot from them, and it was incredible to get their perspective on what it really means to keep an athlete healthy all year long. And so when we combined, I think 9 or 10 different professionals. We had a dietitian, we had a physician assistant, we had a physician, we had a massage therapist, a chiro, an acupuncturist, a PT. We had all these different types of professionals coming in, and what that did was it gave you different perspective on how these individuals help keep these people healthy for the long term. And you get to understand that what you contribute was only a portion of actually what can be maximized for them. And it was very humbling. It was a very, very cool experience. So Tuesday then comes around. Everything that you did on Monday will help with everybody else planning for that next day. And then guess what? Tuesday is rinse and repeat. Same thing. Tuesday morning checkups. They got breakfast. Tuesday morning checkups. Make sure you have anything good to go. Tape them, whatever you need. Work on any soft tissue work, injury checks, update any grain, yellow, red lights that they might need for the day. Send them out, go to practice, watch them, come back, eat lunch, recovery, anything that they need, strength session in the afternoon, or they might flip-flop. They might do a strength session in the morning and then a training session at night, depending on, if you're talking about rowing, if you're talking about pole vault, you're talking about things that are wind dependent, then whatever actually came up, if that wind or the climate changed for the day, then they would alter that based on that. So, or if you had rain or whatever it is, some people can train indoors, some people can't. So you have a strength session and a training session, then you do night injury checks, and then Wednesday was typically recovery. And what that allowed people to do is just have an active recovery day. So it would be stretching, it would be active warm-ups, cool downs, yoga sessions, anything that required them to move without resistance or intensity. That could also be their massage day. It could be an acupuncture day where their nervous system was going to be a little dampened based on the session. So with all those things, you had Monday and Tuesday, which would be varying in intensity. Then you have Wednesday off, active recovery day. Then you have Thursday, which is coming back into the week. So Monday and Thursdays were typically your hardest days, and it makes sense if you're planning across a work week. You have Monday, you're coming in fresh. Sunday was off. Monday, you're coming in hard. You've got a lighter intensity day on Tuesday, recovery Wednesday, we're ready to rock on Thursday. Friday, a technical day or a little bit higher intensity, but not as much as Thursday. Friday might be strength, and then Saturday, you're just working on skills, technical skill, working on fundamentals, going through reps, and really just trying to ingrain, fine tune little things. So, across a work week, what that did for you is actually you got in a routine of what to expect, what injuries were going to happen, and when. And when you start to notice is that injuries were predictable. Sorry, atraumatic injuries were predictable. Trauma is a little tougher, but if you have atraumatic injuries, it became very predictable based on volume, based on everything they did. So it was actually amazing to watch what truly develops pain, and that's repeated stress across time. With either increased intensity, volume, whatever it is. And then you actually got a perspective of what do I do for people? In physical therapy, typically you're working on pain management, you're working on uh, getting them out of pain. In this role, when you work in professional sports, your main role is to keep them out of pain. So we would get people who see me daily, every other day, 3 times a week, saying, I'm not in pain, I just don't want to get there. And that mindset shift for a physical therapist, if you're listening to this and you've been trained through a Western-based school, your mindset is we'll give them 50 different exercises. And for those of you who've listened to my stuff long enough, I'm I'm not in favor of a large volume of things. If the person has a large volume of exercises on their own, they're a professional athlete, they do a lot, 4 or 5 days a week, high intensity, high volume, high strength, and you add more to their work week, it becomes very challenging. If you have a person who's just starting, never trained, deconditioned, I think they might need that. But it's all where they are on this bell curve that I'll explain as we go through these podcasts and episodes and all everything that we go through with future sessions. When you look at somebody who has training all week long, when you add corrective exercises or therapy or whatever you call them, and you add that to them, it's very, very difficult to add to their work week and or their conditioning week. And what that does is it impacts their healing and actually contributes to more injury risk. And so what the mindset change was, wait a minute, no one is in pain here. So what's my job? My job is to keep them out of pain. And I was never allowed to have permission to think like that from a Western-based school standpoint. And that to me was mind-blowing. And I know that sounds really fundamental and basic. And every new grad, every clinician I've ever worked with, they're like, oh, it just makes sense. Then just keep them healthy. Yeah. What happens is that you actually have to work with the strength coach, technical coaches, and other clinicians to make sure that we're not overloading this person. So I like to call it like who's in the driver's seat at what times of the year. So when you have 9 or 10 providers, the main driver is the coach. Behind that is the strength coach making sure that they're achieving what they need. And in time of injury, then it's a medical provider. They now drive the bus with this athlete. And then when you have illness or whatever it is, it might be the physician, it might be the dietitian, it might be, I mean, there's different times. And everyone is driving, it's just who's leading. And when there's too many cooks in the kitchen, somebody has to take ownership. And that was so enlightening for me, and I appreciate that. And you really have to realize that it's not about being selfish and showing what you have, it's about what you can do for this person. And when your skill set comes into place and when your specialty comes into place. And so when you have non-injured people who are coming across a whole year, when you come in, you really are looking at preventative injury prevention. So you work with other specialists to look at, well, in an ideal scenario, how do you set up a whole week? What does that look like? 5 sessions of PT, 2 massage, 5 chiro, 2 acu. Like what is the scenario? And that way you don't overload this person and just make sure that they're eating right and they're actually sleeping. So a whole work week looks like a lot of meetings as well. And you're just reviewing athletes as a whole, working on teams and working through what is ideal for this person. So what's going to happen next is that once you meet with all these individuals, you're ultimately trying to figure out what is the next step for them, because they have a big comp or they have a big session coming up, they have a big work week, they have a big training block for the next few weeks that they're going to need to adapt or change, and you're always forecasting. And as a clinician, that's very different from what you're used to as a physical therapist, anyways, unless you've been in a unique scenario like this. And so, what's the best part of the week? Is making sure at the end of the week that no one got injured. And that was the best. And to me, it was, you put so much work into preventative. You're looking at like quality of movement, what's their movement screening, what is their overall body profile, what's their posture, what's their activation, what does their knees look like, what is accumulating. And you have to have objective data to help you drive, how am I going to communicate this to somebody else so they can reproduce, just in case I'm sick or I'm not here or whatever it is, so that everybody needs to be on the same page. And so it's really hard because sometimes our profession is a little bit of an art as much as a science. And so when you look at a lot of our research, it's really about injury and management. And when we look at preventative, you kind of have to look at strength and conditioning, you have to look at athletic training, you have to look at PT, you have to look at massage, you have to look at a little bit of everything. And preventative work is a little tougher in that you kind of have to put a whole picture together. And so you assign number of days that they get treatment, which treatment is going to do what based on the recovery day, based on their off day, based on high intensity days, whatever it is. From there, you have daily meetings with your own internal team, and then you have weekly meetings with everybody as a whole. So that way you look at who's having a little bit of stressors, whose shins are having issues, whose shoulders are bugging them, but it's not a big deal. We can decrease throwing, we can do this. And so it's always forecasting. The minute you get an injury, you're already in the hole, because now you're going to miss out 4 to 6 weeks depending on what's going on. And that's a big time point. If you're talking about the NFL, you're talking about tennis, I mean, that's a huge deal. So what we need to consider is, what is it that we do for people in the setting that we're currently in. And so if you're in an outpatient clinic and you're working with people who have a fitness level of insert blank, that's a different role. If you work with people who have higher intensity workouts, CrossFit, F45, whatever it is, you have to change and accommodate your style of treatment according to what they do. And I think that's very difficult for a lot of providers. And some of you are listening like, that doesn't sound too complicated. It is from a mindset perspective. And that you have to realize what you're trying to accommodate is what they need and what they want. And in professional sports, there's a lot of what they need. But ultimately, what do they want as well? And it's learning how to blend that. And for some purists who are evidence-based, data-driven, 100% has to be documented and has to be significantly proven, it's really tough in that you're blending as much as you can together. But ultimately, when you see these people daily, now you have their personal interactions, now you have their daily challenges, personal life, love life, professional growth. Maybe they have a good day at practice, and all this changes in the way that they feel. And what you're trying to do is make sure that every work week, every month, that you're trying to stay objective as possible, but ultimately try not to overload them. And that's the challenge I saw with a lot of people coming in, new team members, new clinicians, additional team members. And I was guilty of myself. You throw on too much too soon, too fast. And just because we're used to an orthopedic standpoint in that we won't see them for a week or 2 or 3, and you're like, until the next session, here's your 5,700 exercise I want you to do, and I want you to do them 5 times a day, times 50 minutes. And with these individuals, I actually was giving less. Why? Because I could see them more frequently. I can make bigger differences. I can fine tune a few things just in a few weeks. I can change this movement profile because they're practicing it more and more. I have my eyes and ears on them all the time. And what that allowed me to do was truly understand how much of an art as much as a science it is, especially at the pro level. And that's what a work week looks like. Then there's the relationships that are built upon that, and there's competitions. And then, in competition, it becomes a little different. Everything I just mentioned was pretty much off-season or pre-comp kind of work weeks. And then you have people who take off for a week or whatever it is, Wednesday to Friday. If you work on NFL or MLS, these people are going in and out of season regularly. Excuse me, going out of competition because their weeks are based on flights and schedules, and we can talk about that at a different time. Where when you're looking at time zones and how difficult that is, but ultimately across a work week as a provider, um, it was really about schedules, meetings, forecasting, preventing, and being a support system for an athlete who's going to be yours at least for a year, depending on their contract, and moving into weeks, months, so that they can stay healthy and not necessarily get out of pain. Because in theory, if you did the right testing at the beginning of the season and you could forecast that some people had bad hips, knees, whatever it is, whatever your data is, if you could forecast that and you actually had a year to work on, what would your outcomes look like? If you had a whole year, every single day to work with somebody, what would you do? And I think that's very tough for a lot of people to answer because we've never even been able to think like that. And I'm very grateful to have that opportunity, and I learned a tremendous amount. And actually, I apply it now every day to the clients I serve. In that, how has it changed my practice? It's allowed me to blend what they need and what they want, and listen to them more carefully, and ask them what their month, week, 6 months, and 1 year look like. And that's very scary for a lot of people to answer because they don't have an answer to that. They were just trying to get out of pain for their knee. And when I ask them, what is 3 months, 6 months, 9 months, 12 months look down the line, it's very difficult. And I'm allowing them to think a little differently. And from that, then I give them quarterly challenges and goals. Here's what I'd like to do. If your goal is to do this in a year, I'd like to see you do these quarterly. So right there, I was helping build strength templates every 3 months, looking at training blocks, and then working on correctives to achieve those quarterly goals, and then seeing them regularly, but requiring them to do their things on their own and giving them checklists and check boxes to hit so they can achieve that. And I had to actually work backwards. And some of you listening to this, you're like, that sounds actually amazing. Because in an outpatient based setting, you're working with people who are told they have to come to 12 within 3 months based on their insurance, or 8 or 6, whatever it is. And their goal is to hit measures to prove that they actually have pain. We're not even talking about measures of what they want to get back to. And because we're only allowed to think for 6 weeks or 12 weeks, you're now challenging them to go out 3 months, 4 months, 6 months. And for the right person, they want to hear this. They want to. You're just giving them permission to ask. And what that helps is, for some of you in an outpatient setting, that's easier to build wellness programs and have more people come back to see you and ask for you because you're different, and you're allowing them to think a little differently. You're really just giving them permission, and that builds more trust and creates value in what you do, and they are bought into you as a human, as a person, and then lastly as a professional, and because they understand that you have the best interest that's for them. And that was my work week in professional sports, and it changed. I mean, I'll share more episodes with different specifics on whether it was NFL training or if it was pro tennis or living in Europe or whatever it is. I'll share those episodes down the line. But for those who are interested, that's what it looks like, and it's amazing. It truly was. It's just the introspective learning I had to do as a provider. It taught me that I wasn't just a physical therapist. I was a healthcare provider, and what that allowed me to do is, while I had to learn from other people very quickly to realize that as a clinician, you can do a lot more. You're trained in school to have different skill sets, and you go out and you become pediatric certified or orthopedics or whatever it is. But once you enter the orthopedic, specifically the sports world, your potential is untapped. I mean, you might get a couple classes here and there, but when you go pro sports, it is everything. And you don't necessarily have to do a residency. I think that you can do a lot of things to get there, and I'll share that on a different episode as well. But the residency definitely primed me to be able to be able to handle different scenarios in the acute care setting, the strength world, and be able to blend everything on off the cuff and on demand. And that was the most challenging thing for me, was to be ready to have those things, to tape an ankle, to be able to assess skin and work with physicians and PAs to be able to determine like what's the best course of action, and how to monitor and wound packing. And oh, it was amazing, amazing, absolutely amazing. So I hope all that gives you chills, because it just did to me as I was saying all these things. I love these things. So there you have it. There's my work week in professional sports. If you're interested in more, I will put out more content. A couple other things. Yes, I released the podcast recently. So thank you for all the listeners from all over the world listening to this. Thank you. I've gotten great feedback, so thank you. I'm going to produce more episodes. If you guys have more content you want, I have about 53 different topics I'm working on at the moment. Let me know. I'll keep you updated on my book, updated on sports performance hiring. My wife and I have some fun, exciting news I haven't released on my side yet. So all good things coming down the pipeline. I hope you guys are all well and healthy and moving and feeling amazing. So there you have it. On behalf of my team and the podcast, I hope you guys stay healthy, and I will catch you on the next episode. See you guys.